Hi, good evening, everyone. We are back with another Ask Me Anything session. Today is the 74th Ask Me Anything session, and we have a very young and dynamic doctor, Dr. Niket Patel from Anand, Gujarat here. Dr. Niket Patel is a well-known obstetrician in that area, and they have a brilliant team. He has been associated with Akanksha Research Center and Akanksha Specialty Center in Anand, Gujarat, and they have very well known good team of doctors over there. We are very happy to have you today with us, Dr. Nikeji. So for the first 10 minutes, he'll be explaining about what are the different procedures which you might require in your pregnancy and what is the need for it. So he's going to complete educate us about all the different procedures which you might need in your pregnancy. So please pay attention, and after that, he will take all your questions, and this is going to be an very fun filled energetic session. Please post your questions in the comment box, and Dr. Nikeji will take them soon. Over to you, doctor.
Yes, good evening to one and all. At the outset, I'd like to congratulate all the pregnant women out there who are listening to me through this fantastic app of iMumz. And at this very point, I'd also sincerely like to thank Dr. Jaideep Malhotra and Mr. Ravi Teja, who have taken this wonderful initiative and created and conceptualized this wonderful app through which pregnant women can share their anxiety, fears, and we can allay them. So today my topic or my brief talk will be on need of different procedures or surgeries during pregnancy. So pregnant surgeries or procedures during pregnancy sound scary, right? But any medication or any surgical procedure that helps you keep healthy ultimately is going to keep your baby healthy as well. So think in that perspective. So as far as the procedures that you might require in pregnancy is concerned, there are different procedures starting from a simple procedure of tooth extraction in case of a tooth pain or dental caries or something like that, to a ruptured appendicitis, which may be a life-threatening thing for which someone might need to undergo an anesthesia and then a surgery. So basically, let's bifurcate these procedures of the procedures required during pregnancy into two parts. The first part being the gynecological reasons why one might require a surgery during pregnancy or a procedure during pregnancy, and the second part, non-gynecological reasons or non-obstetric reasons why one might require certain procedures during pregnancy. So as far as the gynecological reasons are concerned, the number one and the very common reason that you all might be knowing about is the cervical encerclage, wherein the cervix of the uterus of the female is not strong enough to hold the babies. So certain females have experienced recurrent second trimester abortions or recurrent miscarriages in between after 12 weeks of their pregnancy, or certain females after doing their ultrasound scan at around 12 weeks mark uh, can be diagnosed with a short cervix, the length of which is less than 2.5 centimeters. So in such a case, a doctor might require or an obstetrician might require to place a suture around the cervix, which can hold your baby, keep it in place, and help the pregnancy sustain so that you get a healthy, mature baby and the risks of preterm delivery, preterm labor, and miscarriages get avoided. Apart from that, the second gynecological reason why you might require a surgery is an ovarian cyst. Something as simple as an ovarian cyst, which can complicate a non-pregnant woman, can also complicate a pregnant woman. So if the size of the ovarian cyst is small, and then nothing needs to be done. But if the size goes up beyond 5 centimeters, and if it is symptomatic and it causes pain to the woman, then sometimes it needs to be dealt with even in pregnancy. And if the same cyst was to be twisted on its pedicle or get tauted, then that might lead to an emergency case where a pregnant female might require a surgery during pregnancy. Now let's come to the non-gynecological reasons of why one might require a procedure during pregnancy. The first and the most common reason is something as simple as an appendix. A pain of appendicitis or inflammation of your vestigial organ appendix might create an emergency due to which you might require surgery. This is the most common reason, followed by cholecystitis, which is inflammation of your gallbladder, pancreatitis, that is inflammation of your pancreas, or in a very vague terminology I can say, if a pregnant woman has met with a road traffic accident, and if there is any soft tissue injury or a bone fracture, which also might require to be dealt with a small minor operation. So all of these are conditions where one actually, and the pregnant woman and the person accompanying her or the family members are extremely worried as to what if my pregnant wife has to go undergo a surgery. There is nothing to be worried about. Nowadays, with the advent of newer surgical techniques, newer anesthesia, safer anesthesia medicines, it is safe for a pregnant woman to undergo different types of surgeries. May be an open surgery where your abdomen needs to be cut open, or with the newer machinery, the laparoscopic surgeries have also become safe in pregnancy. So let's take it trimester wise. That would be more easier for you. Say in the first trimester, if any surgery needs to be done, okay, if it's an emergency surgery like all these factors that we've just discussed, then in any trimester, first, second, or third, you have to go ahead with it. But if it was say a cosmetic surgery which could have waited before we can perform it, ideally it is best to perform any surgery once the pregnancy is dealt with or pregnancy is over. But if you were to do a surgery in pregnancy, the safest period is the second trimester. Why? Because in the first trimester, all the organs in the baby inside your womb are being laid down. The organogenesis process is taking place. And at this point of time, you don't want any external medications or toxins or teratogenic agents to be coming into your body, which might lead to congenital birth defects in your baby. Second trimester, why it is safe is because at this point of time the organogenesis has already taken place. All the baby organs have been laid down. The uterus is neither too big nor too small, so it is the exact or the most appropriate time wherein, without causing any risk of premature contractions of the abdomen, premature delivery, or with a reduced rate risk of miscarriage rates, we can go ahead and perform these surgeries or procedures. In the third trimester, what happens is the uterus gains size and it becomes bigger. So if there is any abdominal surgery to be performed, it is quite difficult even for the operating surgeon. So as the pregnancy advances in terms of gestation, the operating procedure for a surgeon becomes that much more difficult. So ideally, we should avoid any sort of abdominal surgeries in the first and the third trimester, and stick to the second trimester if absolutely required. But as I said, if it is an emergency procedure, then you have to go ahead with it in any of these three trimesters, because ultimately the health of the mother matters, and the baby's health depends on it. And I'm sure that the obstetrician, the surgeon, the anesthetists will ensure and take proper precautions so as to cause least amount of harm to the mother as well as the baby, and everything would be fine. So this, as I told you, it requires a multidisciplinary approach with a surgeon, gynec, an anesthetist, a counselor, all of them in your team, so as to calm the female down, calm the family down, and ultimately tide through the entire procedure in a very smooth manner. Now comes the later half of what after the surgery. So we are always worried about the fact that once a pregnant woman undergoes surgery, will the recovery be same like a non-pregnant woman or like some any other person? So I agree that pregnancy is a slightly immunocompromised state, so the recovery would be slightly slower than probably a non-pregnant woman. But that doesn't mean that you avoid a surgery. If it is required, then you have to go through it, and the doctors with set protocols in their particular institutions will take care that you recover at a brisk pace, and there are no complications which you have to deal with. Apart from that, what one also needs to realize is that the doctor will put you on certain medications if any abdominal procedure is to be performed, like tocolytic agents, something that silences your uterus, because any irritation to your uterus can lead to premature contractions of your uterus, and you want to silence those receptors which cause those contractions. So a doctor will put you on these tocolytic agents, will give you a good dose of antibiotics so that an infection does not creep in, which might lead to a preterm labor. And all things said and done, the entire procedure in this day and age, of whatever grade of procedure it might be, from a simple tooth extraction to a ruptured appendix, managing a ruptured appendix, it can be dealt with safely, and you need not worry about anything. So I would say I would like to end my talk with this, and I hope you've gathered some information about how to deal with procedures, different procedures in pregnancy. If you might require it, God forbid, none of you require it. But if someone has to go through it, then don't worry about it, because in this day and age, it can be taken care of. The entire procedure can be taken care of in a very effective manner. Thank you.
Thank you so much, Doctor, for throwing light on such a topic which is not usually spoken of, and just ensuring that everything is fine and giving more information on that. Thank you so much for this wonderful talk. There are many people who want to know, speak about their problems too directly. So, shall we start taking some questions?
Yes, yes, please.
Yeah. Okay, Doctor. So, first question of the day from Swati Biswas. She's 11 weeks pregnant. Day before yesterday, she had heavy bleeding without any cramps but little back pain. The emergency USG, she couldn't do PVS. The emergency USG showed FHR 171 with normal fetal movements. The doctor said it's a threatened miscarriage. What should be done now? What are the chances of healthy baby? She also mentioned that she have a history of high BP. The bleeding stopped, but she still have spotting. She's very nervous. It's her first pregnancy, and she's 32 years old.
Okay, from what I gather, you asked that you have bleeding at 11 weeks of pregnancy. So minor spotting or bleeding at 11 weeks of pregnancy is not a major concern, but because your doctor has labeled you in the category of threatened miscarriage, I'm sure he must have put you on progesterone, different supplements of progesterone by various routes, that is by oral route or injectable or vaginal progesterone. Vaginal better avoid it because you're bleeding at this point of time. So definitely oral and injectable progesterone, which can help sustain your pregnancy. Apart from that, the blood thinning agents would have been stopped at this point of time if the bleeding is heavy. But as you said that you are a case of hypertension and your BP also rises, I'm sure your doctor would have put you on EcoSprint. If these have not been started, then you can again consult your obstetrician. But apart from that, to answer the second part of your question, that what is the chance of you getting a good, healthy, mature baby? I think if this situation is effectively dealt with, see, any pregnancy beyond 12 weeks enters into a slightly safe zone because you've completed your first trimester and you're already at 11 weeks. This situation would have been more dangerous if it would have happened around, say, 7, 8, or 9 weeks. But because you're already at 11.4 weeks, just a few days to go, or enter into the second trimester, I think if this condition is effectively dealt with proper doctor care, if required, an admission is also warranted in such a case so that a doctor can monitor you more efficiently. And if you can tide over this time, then I think your pregnancy will enter into a safe zone, and there are very good chances that you might end up with a healthy, mature baby.
Thank you so much for that assuring words, doctor. So you no need to worry, Swati ji, according to Dr. Niket ji. So next question we take from Q&A contributor. She is 16 weeks pregnant. She's having severe headaches even after having painkillers. It pains but doesn't stop completely. The doctor suggested to consult a physician. She's taking NICIP tablets. Is it safe?
What tablets is she taking?
She mentioned NICIP, NICIP, maybe some paracetamol.
Paracetamol. Okay, okay. So yeah, from what I gather is you're having headache, and the headache is not stopping despite of you taking medications. So your doctor is absolutely right. You need to consult a physician to analyze, the migraine part of whether you have migraine which develops specifically in pregnancy sometimes, or you might be allergic to certain substances. Your physician will be able to tell you better. As far as the drugs safe in pregnancy are concerned, if NICEP contains simple paracetamol in a dose of 500 to 650, then yes, it is absolutely safe. You can very well go ahead and take it up to 2 to 3 times a day. But for better assistance and better guidance in terms of how to deal with these episodes of headache more frequent, if you get it more frequently, if you happen to get it more frequently during your pregnancy, then yes, you should consult a physician. He will advise you with certain tests, and based on that, you will be put on certain medications which can definitely improve your condition. So yes, please go and consult your physician. That is, your absolute need at this point of time.
Thank you so much, doctor. Actually, NICEP is nimesulide.
Nimesulide. I think you shouldn't take nimesulide. Indiscriminate use of any medicine, during pregnancy is not warranted. I wouldn't recommend you to take nimesulide without a prescription by a doctor. I'm sure the doctor wouldn't prescribe that, but still, yet go to a physician before taking any such tablets.
Okay, Priyanka has a question, which is a very common question. She's in 28th week of pregnancy. She's much tense due to the COVID condition. She just want to know what precautions can be taken at the time of delivery to protect the baby. Is COVID test mandatory before the delivery?
Okay, so I'll take the second part of the question first. Is COVID test mandatory? So the Indian government had made it mandatory, but because of the lack of kits in certain areas, at this very moment, it might not be possible for you to get your COVID test done. But irrespective of that, I think don't get stressed too much about it. During delivery, to answer the first part of your question, how do you take care of the baby during delivery? If it's a normal delivery, there is spreading of aerosol that takes place when a pregnant female either shouts during delivery or utters some words. And so wearing of a mask, wearing gloves, using sanitizers. I'm sure your doctor will take utmost precautions in terms of wearing a PPE kit. All the staff will take precautions. A pediatrician will be called during your delivery, who will take care of your baby and who will be wearing the attire that is needed to protect baby from any infections that might be there surrounding your baby. So I would say that taking general measures like washing your hands again and again, preventing yourself from any sort of exposure. Obviously, downloading the Arogya Setu app also helps. So, take all these precautions during this COVID times. If you are not able to be tested, if you can get yourself tested, nothing like that. Certain parts of India, it is mandatory and all the doctors are recommending it. But if somehow you are not able to get your COVID test done, don't worry. Follow the routine general protocols, and I think you should be fine.
Thank you so much, doctor. We have many people welcoming you. Dr. Jaideep Malhotra ji, she mentioned that welcome Dr. Niket. Dr. Ketu Malhotra is here with us. Dr. Yuvraj Jadeja and Dr. Molina Patel. All of them are with us.
Thank you.
Thank you so much for your warm welcome. Thank you, doctors. Next question by Smita Sharma. She's 23 weeks pregnant. She have backache. How to combat with that backache?
How many weeks pregnancy did you say?
23.
I couldn't hear the
23 weeks of pregnancy. 23.
And backache, right? Okay. So if you're 23 weeks pregnant, you're now in that zone where you're progressing from your second trimester and slowly and steadily entering into the third trimester of pregnancy. The uterus at this point of time stretches or increases in size, and as a result of which there is a stretch on the round ligaments which usually takes place, and that is the reason why these pregnant females at this point of time you might be getting that episode of back pain. If the back pain is not that significant, then I would recommend just deal with it with certain physiotherapy. You can contact a good physiotherapist who can suggest some good stretches, and by the means of that you can definitely get if there's a muscle spasm or a small sort of a muscle ball hindering you, then that might be resolved by that. Apart from that, if it still persists, then you contact your obstetrician and get your vaginal examination done once, to just be on the safer side, to sort of see whether there is any cervical dilatation. I don't think there would be any cervical dilatation at this point of time. Only if the pain is severe, then sometimes such a case might arise. But apart from that, do routine physiotherapy stretches, and you should be fine with that.
Thank you, doctor. Next question by Nagaveni. She have posterior grade 1 lower margin placenta, which caused bleeding for 2 days. The doctor prescribed Tegest and K-Stat tablets. How long will it take for the placenta to move up? What positions should she follow while sleeping? Is the baby at risk?
Okay, so the placenta has this policy of migration. So the placenta can be low-lying in the initial weeks of your pregnancy, but as you gradually enter into the third trimester of pregnancy, the placenta usually shifts up and goes into the upper segment. Even if it persists in the lower part, it is posterior in your aspect, so it shouldn't be a problem. At the most, you might have a few episodes of bleeding, which can be effectively dealt with certain medications. But apart from that, I think as the pregnancy usually increases, or the gestational period increases, it will slowly and steadily migrate up, and it shouldn't be a matter of concern. And what was the second part of that question, Mr. Ravi?
So will it harm? I mean, will it affect the baby's growth? That's what she asked.
No, I don't think it will affect the baby's growth. It is grade 1 posterior. I don't think it should affect the baby's growth. Not at all.
Also, the positions to sleep, she asked, what are the best positions to sleep?
The best position would be in a left lateral position, because that is the best position where more blood flow can be ensured to reach the uterus.
Thank you so much. Dr. Swati has just commented, thank you so much for your positive words. She was worried and concerned about her query, and your answer definitely helped her. Thank you so much, Swati. Next question we have from Surbhi. She is 37 weeks pregnant. Placenta post grade 0. No major anomaly. What does that mean?
So basically, this means that your placenta is posterior. The uterus has 4 walls, the upper, lower, and 2 side walls, and the fundus. So your placenta is on the posterior wall, meaning the lower wall, and it is grade 0. So there are no calcifications. The blood flow in the placenta is good. There's no problem. So nothing to worry about. I think it is absolutely fine. You're undergoing an absolutely normal pregnancy. So just take out all the fears from your mind, and you should be fine. You'll deliver, hopefully, a very healthy baby very soon.
Thank you, Doctor. Abhusha's question: which scan should be done in the 9th month of pregnancy to know the EDD?
Okay, so your EDD is established from the first scan rather than the last scan. So the very first scan that you happen to do in the initial weeks of pregnancy would determine your EDD. And more than that, the date of your last menstrual period helps you determine the date of the estimated delivery time, rather than a scan in the 9th month. A scan in the 9th month would just show you as to whether your pregnancy is progressing appropriately according to the time of gestation. Is there any lag in terms of your pregnancy and the weeks that you should consider from LMP? So it is only going to tell you about the baby weight and the lag at AFI, the placenta. And if your question is just about the EDD, you should refer to the first scan that has been done, or the last menstrual period.
Thank you, doctor. Next question by Jigyasa. She's 17 weeks pregnant and she had the NT scan done in the 12th week, where NB was hypoplastic. So she had double marker test done, which was negative. Should I be worried about it?
So, there are certain cases where the nasal bone is hypoplastic, but the good part is it was not completely absent. It was hypoplastic. Your double marker test has come out to be negative now. Double marker is close to 95 to 98%, accurate. But still, if you want to go ahead and, take out all the worries from your mind, be 99% sort of accurate in terms of whether or not your baby has any congenital abnormalities, mostly dealing with Down syndrome, then an NIPT test can be done, a non-invasive prenatal test, wherein they'll take a simple blood sample and the concerned lab will isolate the cell-free DNA, and based on that, it will give you a more accurate report on whether or not it is something to be worried about, or whether there is any risk of trisomy 21 or Down syndrome. So yes, if you want to be absolutely sure, go ahead with an NIPT test, or if there's no facility, then I would say go ahead with the pregnancy. A hypoplastic bone with a double marker test negative has good prognosis. Don't worry.
Thank you so much, sir. Next question we take from Sarlata. Every visit with doctor, ultrasound is a must or not?
No, sir, Lataji. Every visit with a doctor does not mandate the use of ultrasound machine or ultrasound rays. Mostly the doctors would do ultrasound at a level 1, level 2, and a level 3 scan. Level 1 would be around 7 weeks, where one identifies pregnancy. Again, extrapolating that, the level 1 scan is also considered sometimes at 12 weeks to diagnose congenital abnormalities in the very initial phase. A level 2 scan at 20 weeks, which is where around 20 to 22 weeks a cardiac echo is done, all the organs are laid down, and it is a better time to sort of evaluate all the internal organs of the baby. And level 3 scan at around 36 weeks to see for the weight of the baby. So these are the three major checkpoints, 3 or 4 major checkpoints where you might require, or you will require, an ultrasound rather. Every other visit apart from this, it is fine that your doctor evaluates you by a basic stethoscope or probably a Doppler machine, which can make you hear the baby's fetal sound. And apart from that, monitoring of your vitals in terms of your pulse and blood pressure, I think that should suffice. So ultrasound only in these 4 visits. Apart from that, routine testing is fine.
Thank you, sir. Next question by Urmila Chavan. She's in the 5th week of pregnancy. She have continuous abdominal pain, sometimes severe also. Is there any risk of miscarriage?
Uh, See, sometimes pain very early in the pregnancy can be because of lack of progesterone. So I'm sure your doctor would have supplemented you with some kind of progesterone. It is not a given though. It might be a possibility that there might be some lack of progesterone. Apart from that, as I told you, the round ligaments also have some tension on it because the uterus is starting to grow in size. So nothing major, nothing to be worried about at this point of time. It does happen that when the uterus grows slightly from its original size and shape, you are bound to have some pain. If the pain is extreme, go and visit your obstetrician. Your obstetrician will prescribe you with certain progesterone supplements. And if the pain is not that much, I mean, if it is mild or bearable, then just wait until your first scan happens at around 6 to 7 weeks. Nothing else needs to be done.
Thank you, Dr. Siva's question. Hi, doctor. I'm 18 weeks now and I've started feeling baby movements from the past 2 weeks. Today, from morning, the movements I feel very, very less. Yes, I felt, but very, very less than usual. Should I worry?
I don't think this is something to be worried about, Siva. Basically, a mother starts perceiving movements after the 5th or 6th month of pregnancy, and you are currently in the 5th month of your pregnancy. So, some amount of variation in terms of when you feel the movements and when not is bound to happen at this point of time. But I'm sure as your pregnancy progresses beyond 20, 24, 26 weeks, at this point of time, you'll be feeling the movements of your baby in a much regular manner. Right now, it can be slightly irregular. You might feel it at some times, you might not at other points of times, but at other point of times. But don't be stressed about it. You will as gradually your pregnancy progresses.
Yeah, thank you, doctor. All the best, Sivaji. Next question by Chetali. She's 28 weeks pregnant and also type 1 diabetes. In the last sonography, it was detected that she's having mild polyhydramnios and she don't have any other symptoms. She's very worried and want to know if it's not harming the baby. Please advise.
So, mild polyhydramnios is basically slight increase in the liquor or the fluid around the baby. Now, as long as it is mild, it is fine. Now, this mild polyhydramnios sometimes has a capability of progressing into something like a moderate or a severe polyhydramnios also. That might sometimes be related to some birth defect in the child, but mild polyhydramnios is nothing to be worried about. It might happen in absolutely normal pregnancy also. Just get your sugar levels checked. I'm sure your obstetrician would be taking care of certain aspects like getting your sugar levels checked, checking for or doing a scan, a detailed scan, wherein he or she could find out if there is any problem with the baby. But mostly, if the ultrasound scan says that everything is fine, there's no problem whatsoever with the baby, then you can just forget about the mild polyhydramnios. Just do serial scans at around 4 weeks intervals, and if the liquor is not increasing in amount, or the AFI or the polyhydramnios factor is not increasing, then it's fine. It's nothing to be worried about.
Thank you, Doctor. Jignasa is thanking you so much for answering her question, Doctor. Thank you so much.
Thank you.
नेक्स्ट क्वेश्चन बाय कुमार भास्कर. इनका सवाल ये है कि मेरा लास्ट डेट 10th मई को था एंड इन दिस मंथ शी इज प्रेग्नेंट, बट 5 दिन के बाद मेरे को ब्राउन डिस्चार्ज हो रहा है, मुझे क्या हो रहा है?
So, आपको बेसिकली 10th मई को अगर लास्ट पीरियड आया तो आपको प्रेगनेंसी डायग्नोज हुए 1 वीक हुआ है, तो यू आर बेसिकली टुवर्ड्स द कंप्लीशन ऑफ योर 5th वीक ऑफ प्रेगनेंसी. इस पॉइंट पे कभी कभी ब्लीडिंग हो सकता है, जो एब्सोल्युटली नॉर्मल है, क्योंकि कई बार इम्प्लांटेशन ब्लीड, मतलब जब बच्चा चिपकता है गर्भाशय में, तो वो थोड़ा ब्लीडिंग या ऊजिंग कॉज कर सकता है उस पॉइंट ऑफ टाइम पे, जो कि एब्सोल्युटली एक नॉर्मल साइन है. पर अगर वो ब्राउन डिस्चार्ज बढ़ रहा है या फिर वो चेरी रेड कलर का आता है, इफ द ब्लीडिंग इज फ्रेश, देन डेफिनेटली गो एंड कंसल्ट योर डॉक्टर. अगर if that is related to certain supplementations of progesterone that you might require, किसी और दवाई की जरूरत है, तो आपको वो डॉक्टर बताएंगे. वैसे भी अभी स्कैन में एट द मोस्ट एक सैक दिखेगा, जिसमें मतलब अभी बच्चे का जो बीज है केवल वही दिखने वाला है, सोनोग्राफी में और कुछ नहीं दिखने वाला है. So after 1 week you can go and visit your obstetrician. He or she will do a scan, and based on that they will take a call. पर फिलहाल अगर एक ही बार ब्राउन डिस्चार्ज हुआ है तो देयर इज नथिंग टू बी वरीड अबाउट. अगर ये बढ़ता है तो डेफिनेटली डॉक्टर के पास जाइए, वो आपको दवाई लिख के देंगे, एंड विद दैट यू शुड बी फाइन.
Thank you, Doctor. Shweta, someone asked a very similar question and doctor has explained, so I'm not taking this question. Chaitra's question, she's 10 weeks pregnant, she's feeling uneasiness in stomach and some burning sensation in the chest. Also, there is pain in the breast, please advise.
Okay, so you're 10 weeks pregnant, so you sort of 2.5 months into your pregnancy. At this point of time, the progesterone decreases the gut motility slightly, and females are bound to have certain symptoms like gas, acidity, some burning sensation in the chest. That might be a reflux. Now, if you are a case of a person who has persistent acidity, then this might have just increased because of your pregnancy. Some amount of uneasiness is bound to happen at this point of time because of the rising HCG titers. You're also feeling nauseating, so something burping or sort of coming up or regurgitating into your esophagus is always a sign of uneasiness. So at the most, you can visit your doctor. She will advise you with an antacid, or you can at least deal with it with having a few glasses of water, or increasing your intake of water during these days in the initial few weeks of your pregnancy. That will help. Apart from that, a simple syrup like a syrup Digene, a simple antacid, can help you with that. If you're not comfortable with that as well, then you can visit your doctor. She will definitely analyze the entire situation and give you a medicine which is worthy. And regarding the pain in the breasts, that is absolutely normal. Nothing needs to be about that.
Thank you so much, doctor. Next question, जफर जी का ये सवाल है, मेरा लास्ट डेट 13 दिसंबर का था, मैं 7 month प्रेग्नेंट हूँ,
हम्म।
या मेरी 3 प्रेगनेंसी है, मेरी 1 और 2 डिलीवरी ऑपरेशन से हुई है, मेरे बड़ा बेटा 10 इयर्स का है और छोटा बेटा 5 इयर्स का है, क्या सर मैं नॉर्मल डिलीवरी हो सकती है, प्लीज बताइए। एंड शी इज 29 इयर्स ओल्ड।
तो आपकी पहली दो डिलीवरीज सिजेरियन द्वारा हुई है, मतलब सी सेक्शन द्वारा हुई है। तो इन एन आइडियल केस सिनेरियो, अगर आगे दो सिजेरियंस हैं तो फिर नॉर्मल डिलीवरी इस बार करवाना थोड़ा रिस्की हो सकता है। तो मेरी एडवाइस के हिसाब से इस बार भी आपको ऑपरेशन की तरफ ज़्यादा ध्यान देना चाहिए, क्योंकि क्या होता है कि जब पिछली दो बार आपके गर्भाशय पे कट किए गए हो या फिर ऑपरेशन किया गया है, तो गर्भाशय का वो जो भाग है वो थोड़ा वीक हो जाता है। और भगवान ना करे अगर वो भाग इफ इट गिव्स वे या फिर वो फट जाता है, तो फिर आपको और बच्चे को दोनों को हानि पहुंच सकती है। तो मेरे हिसाब से नॉर्मल डिलीवरी ऐसा नहीं है कि नहीं हो सकती है। अगर आपके डॉक्टर कॉन्फिडेंट है, उन्होंने प्रीवियसली वो प्रीवियस टू सीएस में अगर नॉर्मल डिलीवरी रूटीन बेसिस पे करवाते हैं, एंड अगर वो करवाते भी है तो उनको बताइएगा कि लो थ्रेशोल्ड रखे सी सेक्शन के लिए, क्योंकि ऐसे केसेस में ज्यादातर तो सिजेरियन द्वारा ही डिलीवरी होती है। बट इसमें कोई चिंता की बात नहीं है, अगर तीसरा सिजेरियन भी हो तो भी अच्छी तरह से हो सकता है। और आपको तो पहले दो बार एक्सपीरियंस है सिजेरियन का, तो मुझे नहीं लगता है कि इस बार भी आपको कोई दिक्कत आनी चाहिए।
Thank you, doctor. All the best, Zafar ji. Next question by Richa. She is 12th week pregnant from the morning. She is suffering from the heartburn, and she feel like going urine again and urinating again and again, feeling extreme acidity and mild lower abdominal pain. Suggests a few home remedies.
So a few home remedies, सबसे पहला तो मैं ये बोलूँगा कि you will have to increase the intake of water. Some females I've noticed that just by increasing the amount of water they take helps them in a fantastic way. Because during pregnancy, due to that nauseating feeling, the amount of water that women voluntarily takes, or takes subconsciously, is very less. So try to consciously improve the water intake. Secondly, if the heartburn is too severe, you can very well take a simple tablet Pandy or Pantocid, or a simple syrup Digene. I think that will be sufficient. Apart from that, avoid any type of spicy food, avoid any type of fried food at this point of time, not for a long duration, but at least for these 2 or 3 days until your gut actively back to. Apart from that, in home remedies, take some curd and rice. Take more curd. Yogurt might help you in this case, and space your diet out. I mean, do not take one huge meal at one point of time, like a big breakfast, big lunch, and a big dinner. Space your diet. Have small portions every 2 hourly. That is going to help you. I mean, that is going to keep your gut active, and all these symptoms might reduce with just spacing out your diet, and making a few technical changes like avoiding spicy food, and just sticking to the basics.
Thank you so much, doctor. Next question from Pedro Gautam. She's in 33rd week of pregnancy and with a twin pregnancy. Abdominal edema and slight pain below the navel area at the right side. What could be the reason and what could be the treatment?
Okay, so 33 weeks and twin pregnancy. First of all, congratulations, and it is a very good sign that with a twin pregnancy you are pulling up to 33 weeks and even beyond. And I hope you pull on till term. Now, you are bound to have some pain, not only in the abdominal area but also in the pelvic area near the urinal orifice, because of the increased weight of your uterus. Now, if that pain is associated with hardening of your abdomen, or you feel your abdomen is becoming stony hard, then yes, that is a sign of a labor, and you should just get yourself tested once with your obstetrician, who might just do an internal examination and allay your anxieties. And if there are no contractions associated with that pain, and it is just a pain which is happening not on persistent basis but on a periodic basis, then nothing needs to be done. This is absolutely normal. This is because of the increasing uterine weight in your pregnancy, and this will increase as the pregnancy progresses further in the next 2 or 3 weeks before you actually experience labor.
Thank you so much, doctor. Next question we take from Jyoti. She's 28 weeks pregnant but facing very low metabolism. Suggest what can be done.
Very low metabolism. Does she mean indigestion? Because low metabolism. Okay, so basically, if you're facing low sort of indigestion or something like that, you can take digestive enzymes like a syrup vitazyme, which might help your food digest properly and release enzymes at appropriate periods of times. And apart from that, nothing else needs to be done at this point of time. As I told you, because of the progesterone activity, the gut motility is bound to reduce, and the indigestion in the time of pregnancy does increase. So nothing fancy or specific needs to be done. Just you can take simple digestive enzymes, and I think you should be fine with it. You can ask your doctor to prescribe you with certain digestive enzymes. That's all.
Thank you, doctor. Swapna's question. She had her last periods on May 25th, and yesterday she had cramping and light bleeding. What does that mean? She's having regular periods. Please help.
So your last periods were on 25th of May. So as of this month in June, the 25th has still not come. Today being 16th. You are having interval a period which is slightly earlier than expected. So at this point of time, probably nothing needs to be done. If it is cramp, if it's a very light, mild bleeding, then it might be a bleeding that sometimes accompanies ovulation, because you're having cramping as well. So if you're having cramping on any particular side, maybe right or left, then you might have ovulated, and which might have led to some bleeding along with that, or some spotting along with that. So just wait. If you get your routine periods, then that means you bled slightly early, and you can consult your gynecologist, and she will be able to help you with regularizing your periods. And if not, if this spotting subsides, then you can wait for your periods as per the date that you have, that is 25th.
Thank you, doctor. Next question by one second. Mehta Banjum. She's 15 weeks pregnant and the weight is above 100 kilograms. Also, she sweat a lot and the whole the clothes get wet. She's asking for a suggestion.
Oh, you're 15 weeks pregnant and the weight is above 100 kgs. So yeah, your BMI looks to be high. You definitely fall into a category of medium to high risk pregnancy. If you're having a problem of perspiration and sweating, I think it is better to consult your obstetrician, and I'm sure he or she will guide you for one visit to the physician as well, to just take a toll of things, as to get your tests done in terms of whether you have any accompanied morbidity in terms of hypertension, diabetes, which might lead to these things. And if not, then they will analyze and let you know what needs to be done. But yes, definitely you should be visiting your doctor anytime soon.
Thank you, doctor. Satyanarayana's question. His wife is 34 weeks pregnant. In her Doppler scan, the cephalic presentation anterior dipping in LUS head. Head has crossed the LPM grade 2-3. What does that mean? Please explain.
So, this is pretty normal. This has nothing to do with a Doppler, but usual scan where they tell you the position of the head. Cephalic presentation is basically the first point or the first organ that is presenting or is in the lower side of the uterus. So if it is a breech presentation, then say the baby is head up and buttocks down. If it is a cephalic presentation, means the head is down and the buttocks are up. It is as simple as that. And the second part of it is just regarding the position of the head and nothing else. And the grading, I think, would be of the placenta. So which is also, seems to be normal at this point of time. Grade 2, grade 3 can be expected at 34 weeks of pregnancy. So I think nothing to worry about. Just take care, ask her to take rest, and she should be fine, don't worry.
Thank you, Doctor. All the best, Satyanarayan. Next question by Tulasi. Are there any scans to be done in the seventh month of pregnancy?
In the 7th month of pregnancy, there are no specific scan that needs to be done. There's one checkpoint at 7th month of pregnancy, that around 28 weeks your baby should be around 1 kg. But that does not warrant an absolute scan. I mean, it is fine if you do a level 2 scan at around 20 to 22 weeks, and then directly do a level 3 scan at 34 to 36 weeks. So it is not an absolute necessity. But yes, if you just want to see that your baby's parameters are growing appropriately, and the weight of around 1 kg, that is between 900 to 1100 grams, has been achieved, then you can do a scan at around 7 months of pregnancy.
Thank you, Doctor. Deepika Nayan's question. She's 12 weeks pregnant and she's having persistent low BP, always below 90/60. Usually, the diastolic is in 40s, 50s. Please tell it if it is normal.
See, if your baseline BP is less, I mean, if it is below 100, as you say, it's around 90/60, and sometimes it drops up to 40, 50, that is usually low. So, one, you have to increase the intake of fluids in your body. Obviously, the next time you visit your doctor, tell them that you are having this condition of wherein you are experiencing low BP. But if there are no symptoms, I would say that if there are no symptoms of giddiness, if there are no symptoms of you feeling unhealthy, and you're able to work with a brisk pace in terms of your day-to-day routine activities, then I don't think this should be a problem. It's just that your baseline BP is less. Diastolic of 40 is a matter of concern, but you can get your BP measured accurately manually, as well as by a machine. And if the obstetrician finds a point of concern, he or she will definitely do the needful. But what I can say from my end, just by looking at your history, is increase the intake of your water. You seem to be a very thin, lean person, so try and increase your body weight. Take good amount of folic acid, take good amount of iron, take good amount of calcium, because you've completed 12 weeks. All of this will help you to your food to be metabolized, give you good immunity, and slowly and steadily, I think your BP will fall into place. Don't worry.
Thank you, Doctor. Pavitra's question. She's in 12th week of pregnancy. She's having slight abdominal pain. Is it safe?
Slight abdominal pain is fine. As I told you, you are entering into the second trimester of your pregnancy. The second trimester of pregnancy is considered to be a safe zone. In this, if the pain is slight, it's fine. That this is because of the tautness of the round ligaments. If it increases, and if you feel that the cramping in the lower part or your pelvic region is increasing, then you can get yourself checked by an obstetrician, just as to rule out the condition of second trimester miscarriage. But with slight abdominal pain, I don't think it is anything to be, you don't need to worry about anything else.
Yeah. Thank you so much, Doctor. Sakshi Kapoor's question. She is usually feeling anxiety these days. She's not able to meditate. She's 31 weeks and 31 weeks of pregnancy. Please advise.
So, being anxious during pregnancy is very common. That's why I congratulated Ravi, Mr. Ravi and Dr. Jaydeep Manotra on, conceptualizing this app. If you're not able to meditate, I would definitely recommend there's a meditation program even on this app, which has worked wonders for many females. So you can definitely join in that program, where they teach you different ragas, different, even postures for stretches and exercise, even meditation for that matter of fact. So see if that helps you. Apart from that, try doing things which keep you positive. Try doing things which make you happy, because in this scenario, in the last 2 or 3 months, I know nothing has been good in terms of the COVID or the news that has been coming in. So just spend more time with your family, spread positivity, think positive, be happy. I think that is going to allay your anxiety. If you distract yourself into thoughts which are sort of better in terms of, if you can read a book which would bring a smile on your face, or watch a movie which can bring a smile on your face, all that will help you allay your anxiety. And for meditation, I would definitely recommend the iMumz app. You can definitely log on to that.
Thank you, doctor, for such a lovely suggestion, and we wish you all the best, Sakshi ji. Please feel free to reach to us if you need any help in future. Next question by Tulsi again. Her baby movements are very less, 25th week pregnancy, and sometimes she wants to know the reason. She's also suffering from constipation at times. What should she do?
So I'll take the second part of the question first. To address to constipation, there are two or three things that needs to be done. Increase the fiber content basically in your diet. By fibers, I mean whole grain, cereals, pulses, green leafy vegetables, and increase the water intake as well, as that will also help relieve the constipation. Apart from that, if the baby movements are sometimes very less, then it's not a matter of concern. You are slowly and gradually stepping from the 6th to the 7th month. Mostly after 20 weeks, the baby movements are sort of well perceived. At this point of time, if you're having that anxiety in your mind, if you're living with that anxiety, just get yourself checked with a doctor, get a scan done. Apart from that, honestly, my opinion would be nothing needs to be done. Just take care of your constipation with what measures I told you. The baby movements are going to increase slowly and steadily as the pregnancy progresses.
Thank you so much, doctor. Next question. Next, Priyanka's question. 25 weeks pregnant, and because of some contractions in recent routine checkups, the doctor asked to check the previous cervix twice in the last week to be followed again on the coming Saturday. Is TVS cervix completely safe?
Yes, TVS is basically transvaginal sonography of your cervix, which is basically done at this point of time if the doctor is suspecting, the cervical length to be shortened. The normal cervical length or the basic cutoff would be is around 2.5 centimeters. If in the previous scan your gynecologist has found that that length is slowly and steadily reducing, and they might require to place the cervical encircular suture that I talked about in my lecture today, then they are wanting to analyze that, is the bag of membranes in which your baby is it prolapsing from the uterus into the cervix? If it is, then sometimes an emergency encirclage might just help to sustain that pregnancy, and that is why he or she might have called you for repeated examinations in the past few weeks. So as far as whether it is safe or not, yes, it is completely safe, because it is just a sonographic examination to determine the length of your cervix, and there are no side effects of this, don't worry.
Thank you, Dr. Neeti's question. She had abortion in the last year in July due to baby having oligohydramnios in the 5th month. Now she's now she's 7 weeks pregnant. Are there any chances that it might happen again?
So last time, if it was in the 5th month of your pregnancy, oligohydramnios can be because of a number of reasons. You might have had a water break, because of which there might have been oligohydramnios, or sometimes a baby would have some congenital abnormality due to which there is oligohydramnios. But that doesn't mean that you're bound to have polyhydramnios in this pregnancy as well. You are at 7 weeks of pregnancy. Your doctor will definitely do a detailed scan at 12 and 20 weeks, and definitely put you on certain medications, so as to ensure that the same condition that happened last time around the 5th month doesn't replicate this time. So it is absolutely not necessary that it will happen this time. But yes, because given your previous track record, we just need to be vigilant about it, and your obstetrician needs to be reminded that this happened last time. So he or she will take the required precautions, and this time I think you should sail through.
Thank you, doctor. Next question by Vrushali. She's 15 weeks pregnant. She had bleeding in 2 weeks ago and low-lying placenta. So doctor suggested bed rest. A chronic bleed was still present in the USG. Is still having spotting and black-brown blood clots are still coming out. Is it a problem? She's worried.
So basically, you're in the 15th week of your pregnancy with a low-lying placenta and with a few episodes of bleeding. That is expected because low-lying placenta means your placenta is near the mouth of your uterus, and any friction that the placenta causes with the wall of the uterus is bound to cause some spotting, bleeding, which you it might manifest. So the good part about this is, as your uterus grows in size and the pregnancy advances, the placenta is bound to migrate up in 90% of the cases. Uh, at this point of time, your doctor is absolutely right in terms of advising you with bed rest in a head low position, because that is what is going to help you. The more bedridden you are at this point of time, the less friction the placenta is to cause with the uterine wall, and lesser amount of bleeding is to manifest. So yeah, follow your doctor's advice in terms of resting. And as I told you, once the pregnancy progresses beyond 20-24 weeks, the placenta will be pulled up into the upper segment, and that is the time period when you will stop having these symptoms. And even
Thank
if
you.
it persists, don't worry about it. I mean, some females have these spotting issues all throughout the pregnancy and yet deliver a very healthy, mature baby.
Thank you so much, doctor. That's very assuring. All the best, Roshali ji. Next question, Rama. She's 26 weeks pregnant. She's feeling dyspneic problem and she's type 1 diabetic patient. Please suggest something for her problem.
So dyspnea is basically from what I gather, you are finding it difficult to breathe at some points of time. So what happens is basically in pregnancy, when your uterus grows in size, there is some sort of cardiorespiratory embarrassment that takes place. The tidal volume of your lungs does decrease. So some pregnant women do find it difficult to breathe at this point of time, because your uterus is growing, it is pushing your diaphragm up, and the tidal volume and the vital capacity of your respiratory system decreases slightly. So nothing you need to worry about nothing at this point of time in terms of difficulty in respiration, if it is only slight. If it increases, then definitely go and visit your doctor. And what was the second part of that question, Ravi? What did she want in the second half?
Yeah, yes. Yeah, I think she's also type 1 diabetic. She meant. Yeah.
Yeah, if you're type 1 diabetic, I am sure your obstetrician would have addressed to that and put you on the required medicine, whatever insulin or whatever required medications that they feel you are required to take. He or she would have consulted a physician, and you would have also met the physician. And I do recommend you to take continuous visits with your obstetrician as well as your physician, so that the diabetic portion or the sugar part of your pregnancy is under control.
Thank you, doctor. Next question by Ankita Nigam. She's asking if it's safe to consume wheat grass during pregnancy.
Oh, I have read no side effects about wheatgrass consumption of wheatgrass during pregnancy. The only side effects that I know about is basically raw papaya, wherein the papain enzyme is slightly risky. But apart from that, I don't think there should be a problem with you consuming wheatgrass in the pregnancy. All that you are wary about in terms of what to eat or what not to eat, kindly avoid that in the first trimester. That is what I always recommend to my patients. So yeah, I would say, just because to be on the safer side, try sort of not avoiding this in the first trimester and start consuming it from the second trimester if you want to.
Thank you so much, doctor. Rashmi, she had abortion at 6 weeks of pregnancy. Is it required to give a gap for trying to get pregnant? She don't have any thyroid, BP, or diabetes. How to have healthy pregnancy next time, and what are the precautions you can take?
Okay, so abortion at 6 weeks. So there are many patients who, in their first pregnancies or very primary gravidas, basically in the first pregnancy, they happen to have a miscarriage at around the 5th to 7th week mark, which is what has happened to you. Now, because after that, I'm sure your doctor has tested you, and that is why you know that your thyroid, BP, and diabetes, everything is normal. So there's a very good chance, an excellent chance, that you will have a healthy pregnancy next time. All that you have to ensure is basically 3 months prior to planning your pregnancy, you start the supplementation of folic acid. Folic acid needs to be taken in 0.5 in a dose of 0.5 milligrams right from 3 months prior to planning your pregnancy, and even once you are happen to diagnose with pregnancy, then continue that folic acid supplementation. And the gap, if you have just sort of had an abortion at 6 weeks, then it is always better to give a gap of around 2 to 3 months to help your uterus to recuperate before you plan a next pregnancy. So yes, a gap of 2 to 3 months is warranted before you plan a next pregnancy.
Thank you so much, Doctor. We wish you all the very best, Rashmiji. Doctor, it's already 7 o'clock, and you have been patiently answering all the questions from past 1 hour. And unfortunately, we have so many people want to talk to you and know their answers from you. Can we quickly take few more questions, three, four more questions, and wind up the session, or should we complete it day? Yeah.
No, I can take 3 or 4 more questions, not a problem.
Thank you so much, Doctor. Next question by Yogam. Her sister-in-law is trying to conceive. Whenever she tries to get positive, but after a week she is getting her periods. It's happening every time, but the same problem. All the tests are normal. Please help. How can she conceive?
So yes, Yogam, at this point of time, she definitely needs to. I wouldn't say she needs to visit a fertility specialist, but every time after being diagnosed with pregnancy, she gets periods within 1 week. Then it is mandatory that some tests need to be done in terms of her thyroid prolactin level. And as soon as she is diagnosed with pregnancy, she needs to be put on certain supplementation of drugs which can help the pregnancy sustain. Apart from that, nothing else needs to be done. Just timing of when to have intercourse, basically, that is follicular tracking of the female partner, giving the couple an ideal time zone when to have the intercourse or the episodes of intercourse, and then whenever she misses the first day of a period, to consult a doctor immediately so that all the supportive medications can be started.
Thank you so much, Doctor. Navina's question. She's 36 weeks pregnant with low-lying placenta, and she's having pain in the pubic bone from the past 3 days. Can she do walking? What are her chances for normal delivery?
So 36 weeks and low-lying placenta. So that means the chances of placenta now migrating up is very minimal, or absolutely no chance of sort of placenta going up. But even with a low-lying placenta, there are many females who've delivered normally. Though the chances of section is slightly high, but under strict vigilance and with good sort of monitoring, you can be given a trial of normal delivery, because it is just low lying. It has not yet reached, the placenta has not yet reached the opening or the internal os. But yes, definitely a low threshold should be kept for a C-section. As soon as you have, if you have good bouts of bleeding or some uncomfortable situation, you should be taken in for a C-section. And if you don't, and if with the pains the baby is able to come down and the placenta is able to be negotiated, then definitely you can try for a normal delivery, but with extreme and strict vigilance by obstetrician.
Thank you, Doctor. Next question. Bhanumurthy, her due date is August 22nd, and the gynaec said 25th because she had irregular periods, and the LMP is 4th November. So, what date should we consider?
So, if your gynaec was said August 25th, then he or she would have calculated it. If your LMP is 4th November, then ideally, according to your LMP, your estimated date of delivery would be sometime, say, around 11th of August. But your gynecologist would have done a scan for you. A scan would give you a better idea of the estimated date of delivery, just because you're a case or you're a patient who has irregular periods. In irregular periods, it is not always, you get a period at pinpoint of 30-day mark. So that is where a sonography is more reliable, and your first scan that your obstetrician does around the 6th or the 7th week is going to tell you your exact date or the exact EDD. So rather than relying on your LMP due to your irregular periods, I would say go with what your gynaec has said, and consider 25th August to be your delivery date. Or else, if you have certain doubts, then just refer to your first scan and there'd be an EDD column mentioning your date of delivery there, and you can consider that to be accurate.
Thank you, Dr. Priyanka Gupta's question. She's in 21st week of pregnancy. Doctor suggested Tdap injection, but it is not available in the market. What is the substitute?
Or you can take a simple TT injection for that matter, or you can also take a Boostrix injection. So basically, the doctor wants to give you a tetanus vaccine, which is an absolute must and is usually recommended anytime after your fourth month of pregnancy. The fifth month is the best time to take it, like how your doctor has recommended you to do. So you can take a simple TT, or if you want to take a good variant of it, you can take a Boostrix, which is also available in the market. So yeah, these are the alternatives for you.
Rama's question, her TIFA scan shows AFI 22. Is it okay? And one second. Yeah.
AFI 22 in a type.
Pregnancy.
Yeah, so AFI 22 with type 1 diabetes is a matter of slight concern, I would say, because 22 puts you in a category of sort of mild to moderate polyhydramnios. And with type 1 diabetes, you need to get your scan done by a fetal medicine expert. And if he or she says that everything is fine with the baby, it's just that the AFI is slightly on the higher side, with you being a case of diabetes, then yes, just don't worry. Allow your pregnancy to progress. Do periodic interval scans every 2 to 4 weeks, and take it from there. But yes, at this point of time, you have to increase the number of visits that you take with your obstetrician as well as your physician to deal with diabetes. So it is a matter of slight concern, but given effective supervision, you will be able to tide over it. Don't worry.
Thank you so much, Doctor. It's been a great session. Let's take one last question of the day and wind it up. Hello?
Yes.
Yeah. So, Kanchan's question, can we plan a pregnancy after age 40? Does female can conceive at this age, and what should be her AMH to conceive? Pros and cons. Please.
Okay, so after the age of 40, Kanchan, you can definitely plan a pregnancy. Obviously, when you become pregnant after the age of 35, you fall into a category of high risk pregnancy, because of your age. So even before you are diagnosed to have pregnancy, you will be in that category. After the age of 35, basically your AMH is going to drop. The ideal AMH is between 1.5 to 3.5 nanogram per ml, and I would expect at the age of 40 your AMH to be somewhere lesser than 1.5. If it is still between 0.5 to 1.5, there's a good chance that you might end up with having a pregnancy with your own eggs. Even people have been pregnant naturally after the age of 40, but most of the patients would require certain help. So you should consult a fertility specialist. They will get an AMH test done. They will see the position or the status quo of your ovaries, and accordingly they will advise whether or not you need any infertility treatment in terms of IUI or IVF. Generally, people around 40 would require an IVF, and with IVF, because the amount of eggs that you produce after the age of 35 is not a concern. The concern is the quality of the eggs that you produce. That is, most of the eggs you produce after 35 tend to be abnormal, and there's a slight chance of increased chance of baby having some congenital malformations like Down syndrome or Edwards syndrome. So by doing an IVF followed by or accompanied with PGS, that is analyzing your embryo, doing a genetic testing of your embryo before implanting it into your womb, is going to ensure that you have a healthy normal pregnancy and a live mature baby at the end of it. So the pros and cons would be, yes, the pros would be, if your AMH is good, you can consider having pregnancy with your own eggs. You can do a PGS and rule out the congenital malformations before you implant the baby into your womb. The cons would be, definitely you would fall into a high risk pregnancy category, and even if you happen to be pregnant, you will be the observation and the vigilance to be kept on you would be slightly higher. The number of antenatal visits you take would be slightly higher. So that's about it. I mean, So I hope you have your answer there.
Thank you so much, Doctor. For those who we couldn't take your questions, please post them in the iMumz app and we try our best to answer them. It's been a wonderful session. Thank you so much, Dr. Niket, for answering all the questions in the last 1 hour and taking care of all the concerns of the pregnant women out there. Thank you so much. It's very it's a great session. We are very very happy to have you today with us. Would you like to share any last message to all the pregnant women out there?
So to all the pregnant women, apart from saying congratulations, I would say that pregnancy is a beautiful journey, and not only for the mother but for the couple as a whole. And both the husband and the wife, or the male and the female partner, should be equally involved in it. To all the husbands, I'd like to say that try and keep your wife happy, because this is the time that she needs your support the most. And to all the wives, I'd like to say that spread positivity, be positive, think about happy things, because whatever you think, whatever you do is ultimately going to reflect in your baby, as we say in our Indian tradition. So always think positive, be positive. And as far as this app is concerned, it is a wonderful platform. I would recommend all of you to at least go through or browse through this app once, and it will help you in some or the other way in getting some knowledge. And it might help you in certain other aspects, as I told you, regarding meditation or regarding the diet you need to take in pregnancy, and etc. So it's been a wonderful session with all of you. I hope I've been able to answer all your queries and questions, and hopefully I'll see you guys again soon.
Thank you so much, Doctor. We would love to see you again soon. Thank you so much. Many people are thanking you. I couldn't read all the questions. Rama, Vinita, Navina, Babu, Bhanumurthy, they're all thanking you so much. Thanks everyone for joining. We had a wonderful session. Thank you so much. Have a good day.
You too.
Bye.
Bye bye.